to the One Piece Implant Mentor podcast. I'm Dr. Andrea Joy Smith, your host and your mentor. My guest tonight is not only a colleague, but she is a very dear friend. Dr. Kimberly Lucas Benton is in private practice in the San Francisco Bay Area. Dr. Benton is an associate professor in the Department of Diagnostic Sciences at the University of Pacific School of Dentistry and has done so for the past 17 years. She is about to, however, embark on her new role with the University of Pacific as clinic director of the Pacific Health Collaborative in Sacramento, California. Dr. Benton, welcome to the podcast.
Thank you, Dr. Smith.
I believe that you bring a very unique perspective to One Piece implants because having known you for a very long time, we used to talk about procedures that we love to do and procedures that we don't love to do so much. And so I want you to tell our viewers what led to you getting into doing One Piece dental implants.
Speaking of procedures we don't love so much, I used to tell you, Andrea, I don't do surgery. And you said, but this isn't surgery. It's so simple. You just make your stent, you make a little drawing, you do your pilot insert, and that's it. And so what really convinced me was the time when you were so gracious to take care of my wonderful hubby, Mark. Mm-hmm. And I came up to your office and you sedated him because, he was a little nervous. I would have been too.
Yes.
And to watch you do that procedure, it really was what you said. It was really so simple. And of course, you have all that experience. So I know part of that to me is like, of course, it's going to be simple for her. But I did feel much more at ease about it watching you do the procedure. Okay. And then, of course, you invited me to a seminar where I could get some hands-on experience. And that just really made me feel more at ease. And knowing that I had you as well as some other folks that were in this wonderful group to help share that experience in case you had any questions gave me a lot of comfort.
Well, that's very, very good. I do remember that day. Your husband was sedated and he sort of heard through the sedation that you were saying, oh, wow, I think I'm going to start doing this. I can do this procedure. He literally forced to do the procedure.
Yeah, I felt it was very straightforward. We had the little mannequin jaws to actually practice on and plenty of faculty to come around and help us out.
Yeah.
And then I think the sealing factor was be able to watch a live surgery that was piped in. And again, part of you is like, okay, well, they do this every day. Of course, they're going to do it in 5 minutes.
Right.
But you realize watching the technique and having the specific steps to follow that it's very possible for you to do as well.
So you would say those are the things that led to you being very confident in providing that procedure, just having someone to watch a live surgery, go to a hands-on course.
That made me feel very confident. And then knowing also that when I was ready to do my first surgery, I had a mentor like you to come help me out. It's like anything else that's new. It makes a difference when you have someone that's the SME sitting there to literally hold your hand if needed and walk you through the procedure.
And that's what this mentor podcast is all about. As I've told you a few times before, many doctors who are thinking about this procedure, they don't really know very many dentists that are performing it. So my goal with this podcast is to introduce them to several doctors that I know who are doing the procedure. It's changed their practices in a lot of ways. And that is the whole purpose of this podcast. Do you find a significant difference in doing this one piece implant procedure versus the more invasive dental surgery procedures?
Absolutely. Of course, I still have a few patients, depends on their needs, that have the wider diameter implants, and then I restore them. But the process, it's 3 months once you place the implant or the extraction, and 3 to 4 months before you place the implant, and then 6 months before you're able to get a tooth in there.
Yeah.
Whereas with these, it's at least half the time. Technically, I know we could load them sooner than 3 months. It just depends on the patient. But that healing time is nothing like what you go through with the wider diameter implants.
Sure.
Getting feedback from patients personally. So I think a big significant difference. And the patients love it because they go home and the next day I get them back in 24 hours and they're like, you're right. It's okay. They have to follow what we say about icing, etc. But
Yeah.
9 times out of 10, they're going to
Mhm.
come in the next day going, "Oh my gosh, that wasn't bad at all." And
Yeah.
that's what gives you pause, and it makes you feel good that you're able to provide that service with
Mhm.
minimal trauma or drama.
Yes. Exactly. What I love about this procedure is that it is a bit more immediate. You don't have that second surgery to uncover the implant, place
Right.
the additional parts. The patient doesn't feel like they have to go through a lot, two surgeries, and then to go through that first surgery, which is the more dramatic of the two, and then to
Yeah.
come out with no tooth to show for it. It's hiding under the bone while it's integrating into the bone. And so having that immediate effect, because we know that we want to load it at 30 Newton centimeters. If it torques at 30 Newton centimeters, then we know we can put a temporary tooth on there, or we can load those dentures. And that is a big, big plus. It's a big advantage over the wider conventional style implants.
Yes. And the
Yeah.
patients, most importantly, from their perspective, minimal to little pain. They don't know the difference between the one piece and the
Mhm.
wider. They just know how they felt and how you made them feel. And did you hurt them? That's what they're looking for.
Exactly. So let's just say a root canal or surgical extraction is about a 10 on a scale of 1 to 10, and a cleaning is about a 1. Where would you rank the one piece implant surgery?
In terms of simplicity, if a one is a cleaning and a root canal is a 10, I give this probably a 2. It really is that simple. I mean, it really, really is. And again, this is coming from someone who doesn't like doing root
Root
canals, as you
canals.
know, heard them out, don't like doing surgery. It really is pretty simple.
I'm really glad that you've had that experience. When you tried to implement this procedure into your practice for you to get your staff on board, was it difficult? Did they have any trouble learning the armamentarium, setting up for you?
Not at all. You just walk them through it. You come back from the conference and you say, "This is what we're going to do." You have to make sure you order what you need
Mm-hmm.
because you want to make sure you're providing the best care for them. But let my staff know on the days that we do surgery, don't put anything else in the second chair. So it's just a matter of like anything else that you're going to add new to your office,
Mm-hmm.
making sure you have all the correct armamentarium. So when you
Mm-hmm.
train your staff,
Mm-hmm.
they feel comfortable. And there's a little bit of a learning process like anything else, but in terms of the mindset, that was not an issue at all.
Oh, very, very good. There are a lot of things that we can invest in dentistry. We can buy a CEREC. We can buy all types of things that enhance our practice of dentistry. But in terms of the startup cost for the one-piece implant procedure, you had to buy the motor, the initial supplies, and things like that. How long did it take you to actually recoup those startup costs for starting one-piece implantology? How many cases did it take you to recoup those costs?
Good question. I had a couple of larger cases in the beginning and then a few smaller ones.
Mm-hmm.
So I would say anywhere from 3 to 6 months at the
Okay.
most. And having those larger cases
Mm-hmm.
basically in the beginning almost paid for it. And when
Yes.
I say larger, I think I had 4 to begin with, and then I had another one where I had 3. And then, for me, I did a lot of the single tooth implants.
Yes. Yes.
So it didn't take that long.
Yes.
And patients, again, they just love it. A lot of times when you order these other pieces of machinery, it's going to take you years
Mm-hmm.
because, it just depends on what you get. But I
Mm-hmm.
would probably be between 3 to 6 months.
For the one piece implant technique, the startup costs are, I think, $10,000 or maybe even less. You buy the motor, you buy the
Yes.
essentials kit so that you can have enough implants. And actually,
Hmm.
in that essentials kit, there is more than enough to stabilize 2 or 3 dentures, a couple of
Yes.
single tooth. And so by the time you do that, that kit is definitely more than paid for. So
Yes.
when you started implementing the procedure, what kind of blueprint or plan did you follow to get it going into your office?
Well, the good thing is, you want to look at the various marketing that they recommend. And
Mhm.
I've always been one to educate my patients. And so it's not selling, it's educating. And
Right.
so we come back and say, "Oh, we have some great news." I
Yeah.
would not only talk to patients that I knew were missing teeth that needed this procedure or
Uh-huh.
could benefit, but I would say things like, "Hey, we've got this new technology. If you know anybody that is looking to have some implants done,
Mhm.
we have a way that's less invasive, less
Mhm.
painful, less cost.
Yes.
Please pass it along. I'm happy to do a complimentary consultation." That really helped, the
Good.
complimentary
That's
consultation.
good. That's actually a good way to implement. You start with your own patient base and their friends and family or people that they may know. That's a very good way to start
Yeah.
out doing it. You mentioned the less invasive nature, and I wanted to touch on it earlier when we were talking about the simplicity of the procedure. One of the things that you need, the whole thing doesn't work. And the startup cost at that time was like $25,000, if not more. And that
Yes.
was to only be able to deliver one or two implants, 1 out of 10 implants, because it could be cost prohibitive sometimes.
Right.
You're doing a $4,000, $5,000, $6,000 procedure. You're not going to get a whole lot of takers in the very beginning. And
Right.
so when I initially thought of doing it, I had a company come out. They brought their kit. I actually attended one of their courses. And when I found out the startup costs were so high, and then I had the rep come out and I started treatment planning those implants with other patients. And then when I would present the cost was so prohibitive that maybe 1 out of 10 people would accept. So I
Yes.
never followed through on doing the conventional implants really for that particular reason. But when I found out about this technology, it's almost a no-brainer because
It
it
is.
offers something that not a lot of other people are doing. And that's why I'm doing this podcast, because I want other doctors to know that they too could be doing it. And right now we're in this little sweet spot where I tell my patients sometimes, this is my best kept secret, but I do want more doctors doing it. What do you think about getting more doctors involved in the procedure?
Oh, absolutely. Then it just goes to show, we do the research, right? And it's
Hmm.
been wonderful. I remember going to a course and then hearing Dr. Gordon Christensen come
Hmm.
and talk and share with us the research behind one-piece dental implants,
Yes.
how they are just as strong as the larger diameter. And
Hmm.
of course, you have to pick the case. What's the best case for you?
Yeah.
But when you realize that it's really not that difficult and the impact you can make in people's life, I can think of 3 patients in particular that had, say, missing tooth number 7 and the
Hmm.
bone was gone, and they went to see an oral surgeon who said they didn't have enough bone, nor do they have enough bone to bone graft. And
Yes.
telling them, well, hey, let's try this, and it worked. It
Hmm.
literally changed their life.
Yeah,
you know I have
absolutely.
3 patients in particular I can think of that said, wow, I never thought I could close that space.
Hmm.
And we understand how you have to have a certain amount of bone for a larger diameter.
Yeah.
But when they don't want to do a partial or a flipper or a
Hmm.
bonded bridge to be able to present this option, why not? Why not be able to provide that service for your patients? So the more dentists that we have that are providing it,
Hmm.
the more it's going to add to the research that
Yeah.
shows, well, look at the number that's been done, look at the
Hmm.
success rate, and it's definitely worth trying and adding to your armamentarium.
That was actually going to be one of my questions to you is what impact did it have on your patients? And I can tell from your answer that it's a tremendous impact. If you're missing tooth number 7 and you don't have the bone to support a conventional implant, even if you get a bone graft, the bone graft isn't guaranteed to take either. The bone graft itself could fail. And
Exactly.
so having this kind of procedure in your armamentarium or at your disposal, it's just a great thing to have because it does impact the lives of so many people. One of the biggest impacts I have is my patients who have been wearing dentures for a long time.
Mhm.
Lower dentures floating around. They have a subscription to Amazon for tubes and tubes of Fixodent that they
Yeah.
go through every single month. And when they no longer have to do that, it is just life changing and very impactful. What impact did it have on your bottom line?
Oh my goodness, it definitely improved my bottom line. And you realize you don't have to place that many to do it. Of course, the more the merrier. But I don't want people to feel like, oh my gosh, I have to place, 10 a week or 10 a month or whatever. You go
Yeah.
at your pace. And I think if we go back to educating our patients on options,
Hmm.
it's going to come. It really is. I did do a little outside marketing for a while, and I think that helped a little bit.
Hmm.
I found definitely is word of mouth because once you have a happy, satisfied patient, they're going to share
Yes.
that with their family members and friends. So that would really be my recommendation. Focus on where you are and
Uh-huh.
just start having a conversation.
Yeah.
Don't feel like, oh my gosh, I have to sell this patient. No, let's educate the patient on the new technology that we have. And that
Absolutely.
statement of, do you know anyone? Sometimes they'll say, yeah, me. So the more conversation you have, the more patients you're going to get. It's going to improve your bottom line, and you're not going to be stressing about it.
Yeah, I like your philosophy of not approaching it as a sales opportunity. It's more of an education opportunity because when we diagnose things every day, there's things that we see that we watch because there's not a whole lot we can do about it. And we refer a lot of patients for things that we don't necessarily do in our office. And so
Yes.
having this little tool in your tool bag that you can pull out at any moment, you can replace a tooth. In fact, today I had a patient who's 80 years old and she saw me on television. She really only had 4 teeth remaining up top. Number 9 had broken. It was a crown, but she had this partial. So, of course, I actually recommended to her first to have the tooth added to the partial, but I really couldn't clasp another tooth because the clasp had led to the destruction of number 9. And
Yes.
so she said to me, I was hoping to get one of those mini implants I saw you talking on TV about. And I said, well, yeah, we can certainly do a mini implant. I said that actually might be a better option. And what I'll do is I'll place an extra one on the side so that your partial can snap into that and I won't have to clasp this other tooth. And she goes, you can do that? I said, yeah. She says, well, how much additional? I said, you know what? I'll just do that at no charge just to improve the quality of your life. So we're going to do the extraction and implant on number 9, and then I'm going to put one in there so that your partial fits in. And she was as happy as can be. With the cost of the implant being so affordable, I charge $1,500 for the implant, $1,500 for the crown. The cost of the implant is about $100. It was not going to hurt me to put another $100 implant into her bone, and I'm going to save the teeth from being clasped, and putting it in, it's like walking, you know.
The impact that you have for her, she's going to share that with her friends, with her grandkids. So it will come back. It definitely comes back. And sometimes I believe that's what we should do. We're blessed to be in this profession where we can have that kind of impact. It shouldn't always be about every little nickel and dime.
Absolutely. I don't have to make every penny. I don't feel that. And the margin on this is so large that I could have even placed 2. I do it from the kindness of my heart. I want this case to succeed. So if you're coming in expecting to get 1 implant and all of a sudden I tell you you need 2, I don't want to double the price on you. I want to just do the thing that's going to make this case successful for you. And so that's the mentality that I take with this procedure, because it's a blessing to provide it.
It is. I agree.
Any other advice for the newbies out there who are a little bit hesitant? They're like, yeah, Dr. Benton said she didn't like surgery, but I really don't like surgery. What would you tell them?
The first thing that comes to mind is do it afraid. Just do it. And know that you have the support from Dr. Smith and team. And there's people you can reach out to that's going to really make a big difference. Just go ahead and do it. Think about the benefits that you can provide for your patients. Think about that person that's just been putting things off for so long. And I get it. Dr. Smith will tell you, she's been bugging me for years. I said, I don't do surgery. And she kept trying to convince me it wasn't. I'm like, When I finally saw her work on my hubby and see how easy it was. And when I say that, I mean, granted, we're all going to have a little trepidation, and that's okay. But just jump in. Know that you've got the support. And like I said, do it afraid.
Do it afraid. I remember specifically shaking in my boots when I placed my first implant case. And sometimes I show that in my lectures because the implants were not straight. I didn't have a stent. 2 were like this, but 1 was like that. I couldn't get the 4th one in. I had to refund her. At the time, I was charging $750. And because she didn't get 4 implants, she wanted the $750 back because I put in 3. And then I started just doing global pricing, whatever it takes to stabilize this denture, whether it's 3 or 4. I did those in 2007, and those implants are still in her mouth today. So it's a procedure that has a lot of longevity as well.
And I think the other thing that helped me too is realizing you can back it out. You place it and you may not exactly like where it is. You just hit that reverse button. It sounds like that truck backing up.
Yes.
But you're like, okay, good. Now let's move it over. Let's figure out where we need to place it. All the way along the time, you're letting the patient know the procedure. You let them know ahead of time. We have a stent. This is where we're going to place it. We may have to modify that based on how things progress. But as long as you're communicating with your patient, they're absolutely fine.
That's really a good point. And the reason you can back it out and move it over a couple millimeters is because we haven't disrupted this blood supply. We've only prepared a pilot hole. It's not a full osteotomy. And as that implant is progressing through the bone, it's actually condensing that bone around it. And so if you take that implant out and you remove it, there's not a whole lot of disruption there. It's just going to heal back the way that it was. In fact, it might even make the bone in that area just a little bit stronger. It's a very forgiving procedure for sure.
Yes, it is.
I have certainly enjoyed our time, and I'm hoping that doctors that are listening to you can take something from your story and realize that even though we have hesitation or a little trepidation about doing something new, this is certainly a procedure that is at least worth trying and doing it while you're afraid, because we've all been there. So thank you so much for joining us. Thank you for telling your story. I knew all the answers, of course, because I've known you for so long, but for other doctors to hear it, I think is very impactful. And I thank you for sharing it.
Thanks for having me. Remember, if I can do it, you can do it.
That's a great way to end. And thank you all for joining us tonight. Next podcast, we will again talk to a doctor who has had some experience placing these implants, and they're going to share their insights with you as well. Thank you for listening, and good night.